All right. So I'm Dr. David Greene, founder and CEO of R3 Stem Cell. What I'm going to cover is what makes international stem cell procedures different than that performed here in the United States. What kind of biologics are being used? Where do they come from? How do they work in the body? Will stem cell therapy cure my condition? Do the number of stem cells matter for a treatment? What kind of outcome can I expect, and for how long will it last? Are there risks? What are the side effects? And then how did we come up with our pricing? Are there any extra fees? I like to be as transparent as possible. Okay, I started R3 Stem Cell, 13 years ago. I was actually in business school at the time after I left practice, and it was a class project. And then I made it a real company after one professor after another kept telling me what a great idea it was. And now we're the busiest regenerative therapy clinics in the world. We're definitely the busiest in Mexico. We surpassed 25,000 stem cell procedures this year. We've been in Mexico for 6 years now. There are 2 clinics. One is in Tijuana, just over the border, literally 3 minutes. I was just there on Friday, so I timed it from the border to the building, 3 minutes. We're also in Cancun, in downtown Cancun, close to the hotel zone. We treat over 70 different conditions. We are on the cutting edge of regenerative cellular technology. I'll explain more about that as we go. And we've developed over 25 customized protocols over the last decade. We know there's a lot to consider when you're looking at a stem cell procedure. It's even after this decade of growth, it still represents new technology. Patient education is key to help you make appropriate healthcare decisions for yourself or loved ones. So we know that you need accurate facts to know if it makes sense, to leave the country to get one of these procedures. Unfortunately, a lot of competitors disseminate information that is inaccurate with biased agendas. And we have over 800 educational videos on our YouTube channel with accurate information. Just last week, I completed this comprehensive consumer guide. It's available on that URL, r3stemcell.com/comprehensive-guide. It's free. It's over 300 pages. There are chapters on over 30 specific conditions. Here's a table of contents. I wrote 4 chapters initially on stem cells, exosomes, PRP, and then FAQs. And then alphabetically, you can see, the conditions, everything from arthritis to Parkinson's, back pain, cerebral palsy, autism, diabetes, stroke. It's a lengthy list, and I'm probably only halfway, through what I eventually want to write. So a lot of references in there showing what research studies peer-reviewed from around the world are showing on these conditions that mirror what our experience is, okay? What makes procedures internationally different? Well, there is no FDA. There is a comparable regulatory division. In Mexico, it's called COFEPRIS. It's very good. We have to register with them, which our lab is, our clinics are, but it is less restrictive in a sense that we are allowed to culture, expand the stem cells there, which is great because we can't do that here. And, anytime you have new technology, commercialization is going to get ahead of clinical trials. There are plenty of clinical trials that have been done and are going on for stem cell therapy. It's one of the reasons that, we get more and more and more interest in our procedures because they work very well. Now, one of the bad things about international procedures is you have to be very careful with the quality assurance. A lot of labs and clinics are cutting corners because they want to come in as cheap as possible, and that's doing a huge disservice to you, the potential patient. Um, and we've seen this time and time again. A lot of labs and clinics just don't get anywhere close to what the US FDA does. We actually go above and beyond that. I'll explain that here in a bit. The biologics, as I mentioned, we are allowed to expand the stem cells. Um, there are some applications that we do all the time internationally, but we don't do much, if at all, domestically. One of those would be intrathecal. I'll show you that on the next slide. Now, the price may be a lot lower than what you'll see in the States. It may be more expensive. We have some competitors who have really, I'm not sure what the term is, jumped the shark when it comes to pricing that is ridiculously high. Yes, they offer good quality treatments. So do we. And, we're very affordable. And I'll explain why that's super duper important as we go. So here is one of our doctors in Mexico, Dr. San Miguel. He's been with us for 6 years now, doing an intrathecal procedure. Basically, it's a spinal tap in reverse. And he's done hundreds of these for us over the years. Results have been fantastic. It's a very safe procedure. He probably cleaned this person's back 10 times with betadine and alcohol, sterile gloves, and it's been a very safe. It's the same way that anesthesiologists do it at the hospital for a spinal tap, except instead of taking fluid out, we put the mesenchymal stem cells into the spinal cord. This gentleman has a spinal cord injury. He actually has done very well. He's one of the success stories on our YouTube channel. But we do it for other things, stroke, autism, cerebral palsy, a lot of different neurologic. It's a very safe way of getting millions and millions of mesenchymal stem cells into the central nervous system. Whereas if you do it just IV, like a lot of clinics do, the blood-brain barrier is a barrier to the stem cells getting into the brain. What kind of biologics are we using? Now, I can't speak for other entities, but our biologics are derived from umbilical cord tissue, specifically the gelatinous matrix of the umbilical cord, which is called Wharton's jelly. The very high quality mesenchymal stem cells are located in the Wharton's jelly. We also use what's called stem cell exosomes, which I'll talk about. Those are byproducts of stem cells. They're 100 times smaller than mesenchymal stem cells. They have no problem getting into the brain or wherever they need to go. We do use what's called allogeneic products. That means they come from a donor, very simply. We get asked all the time, how do you make sure they're compatible with me? And the answer is they don't have what's called MHC2 markers. Those are the markers that would spark up a rejection reaction. They don't exist on umbilical cord stem cells, so we do not get a rejection reaction. We never have in 10 years. Typically in Mexico, we use fresh mesenchymal stem cells right out of culture. They're not frozen. And that means they're 99.9% viability. Very, very high quality, which I'll go into. All right, why do we use umbilical cord stem cells? Well, 12 years ago or so, we used to use amniotic stem cells from amniotic fluid, which are fine. There's nothing necessarily wrong with them. It's just we have a better option with the umbilical cord mesenchymal stem cells. We don't offer autologous stem cell treatments, which is where you would take a person's fat or bone marrow from him or herself. And the reason is because we get much more consistency and activity from the umbilical cord donor stem cells. We culture the Wharton's jelly stem cells in a clean room that is CGMP compliant, ISO certified, COFEPRIS registered. We keep the culturing to the fourth generation or less. Through the fourth generation, actually through the sixth generation, the potency, purity, activity of the mesenchymal stem cells is preserved. And that's been seen with the International Society of Stem Cell Research. So we've had very, very good results with that. Now, when it comes to the passages, some people say generation or passage, it kind of goes back and forth. A lot of competitors go way higher than that. Why would they do that? Well, it's because it's a lot less expensive to produce than what ours are. Because when you stop them at the fourth passage, it's you could make your cost of goods, your stem cells, less expensive to make by continuing to go more and more passages. But it's a disservice to you when labs do that. We see it all the time. All right. So we make sure to stop it at the fourth passage or less. Now, here's one of the reasons we don't use autologous stem cells anymore, such as with bone marrow. So this chart shows how many stem cells are in your bone marrow as you age. All right. When you're a newborn, 1 in 10,000 cells in your bone marrow is a stem cell. By the age of 30, that drops by a factor of 25. So big time. But then when you get to 50, it drops by a factor of 40. And then by the age of 60, it drops by a factor of 200. And a lot of our patients are 50, 60, 70. It just doesn't make sense from a quantity standpoint, not to mention they're less active to begin with as we age. So for those two reasons, it's not worth it. Also, just to let you know, when you have a bone marrow aspiration, it's very painful. A lot of times you have to go under sedation for that. But that, after you get taken out of sedation, patients often have pain for months from that. So for those three reasons, keep that in mind. Now let's discuss exosomes for a moment. We are one of the very few clinics around the world to not only give patients exosomes with the mesenchymal stem cells, but also to include them at no cost. Now, if we need a lot of exosomes, you'll get past the complementary part, right? So, but a lot of times what we include doesn't cost you anything. Exosomes are 100 times smaller than stem cells. You can see here that, on the top, this is a cell. Let's call it a stem cell, all right, or half of one. And basically, let me try and get that away. What you have is inside the cell, you have what's basically called a liposome, but let's call it a soap bubble, all right? And that soap bubble has a lot of components inside, a lot of proteins, and those are cytokines and growth factors inside the bubble. Now, that bubble will eventually go to the surface and release its contents into the extracellular environment, which could be the blood, it could be, another area. Those are exosomes, as you see there. Now, what they will do is they will seek out inflammation and they will attach to those cells and get ingested by them, and then they release their contents, their payload, okay? And that payload does what's called cell-to-cell communication, where it provokes a lot of repair and regeneration. All right, so that's how exosomes work. There were great studies done close to 20 years ago at Stanford where they combined the circulation of mice, an old mouse to a young mouse, and they gave a muscle injury to the old mouse. Normally, if you give a muscle injury to an old mouse, it's not going to heal very well, kind of like what happens in older humans. But in this case, the young mouse blood flow helped to repair that muscle tissue incredibly well, like gangbusters, okay? And they repeated it to see if it was stem cells that showed up in the repair? And the answer was no. So the theory then and the theory now is that those rejuvenating factors are exosomes. So exosomes were deemed the fountain of youth back then, and they still are looked at that way. And there's multiple studies that have been done since then in the mice where they looked at it on aging, it helped them live longer, on heart disease, it helped the heart function better, on stroke, it helped it improve and repair itself better. So it continues to show excellent results. So the reason that we use both is that umbilical cord stem cells work well, but they have a slower onset of action that kind of goes like this. Exosomes have a faster onset of action, and it appears that they don't last quite as long as umbilical cord stem cells. So we like to use them together with the 1-2 punch, and the results have been fantastic. And all treatments in Mexico where you get 50 million or more stem cells do get included at no cost, at least 25 billion with a B, billion exosomes. Where do the biologics come from? Okay, so consenting donors after a scheduled C-section. There's plenty of scheduled C-sections being done, in Mexico, the United States. Because it's scheduled, we have a chance to get a questionnaire completed by the donor, a consent form. The yield is higher because it's a C-section. It's a sterile environment, all right? And we have less chance of contamination, okay? Now, here's a typical certificate of analysis. I'm showing you this one from the United States because it's in English. The ones from Mexico are in Spanish. This way we wouldn't have to translate in real time. By the way, if anyone has questions, please hit me up. All right. Okay. So the certificate of analysis, what does that mean? Well, we do a lot of testing. We test for a lot of different disease entities. Most of them are shown here. Hepatitis, different types of hepatitis, HIV, syphilis, West Nile virus, and there's a few more in the Mexico lab. We also do sterility testing. So they do sterility testing before it goes into culture. Between passages, it gets sterility testing. So thankfully, we've never had a deep infection. I'll knock on wood. We've had some, superficial types of things. We also check for endotoxin to make sure that that's normal. And so this is very expensive testing. You don't have to worry about that, right? Because we do a ton of it, so we keep our pricing for patients as low as possible. But a lot of labs, a lot of clinics do not do all of this testing, all right? Because, it's expensive. But in order to assure the highest quality of cells and safety, it's necessary, okay? And we have it done by a third party so that it's not in-house and, it's unbiased, so to speak. Oh, yeah, here's one in Spanish. Another thing that gets tested for are surface markers, as you can see here, to make sure that they're very active mesenchymal stem cells. Over 90% is the standard, and here you see 100% have it, okay? And then they check for potency, approved, and then, mycoplasma, bacteria, it's this is just one page of several, okay? They also check for colony forming units, doubling population, viability, all right? So it's really strenuous. Oh, here's another, I'm just gonna skip that. All right. So the key point is that the safety that we apply when we have international clinics is equitable to FDA standards. The rest of the world looks at the FDA as the gold standard for everything. I know a lot of people in the States look down on the FDA, but they do have a large budget. They do have a lot of regulations. So our lab and facility are accredited by COFEPRIS. And as mentioned, we test for surface markers, communicable diseases, sterility, in both locations. Will there be a potential for rejection? The answer is no. As I mentioned, umbilical cord stem cells are immunologically privileged. They don't have the MHC2 markers that would cause a rejection reaction. Okay, exosomes don't either. Exosomes are not cells, by the way. They're byproducts of stem cells. They don't have a nucleus. They don't replicate. Is there a potential for a tumor formation? With the types of stem cells and exosomes that we use, the answer is no. And there are plenty of studies, such as this one. Human Wharton's jelly stem cells do not induce tumorigenesis, unlike human embryonic stem cells. Human embryonic stem cells are the ones that come from an aborted fetus, okay, or a leftover embryo from an IVF procedure. So we don't use those, notwithstanding the ethical factors, also because they do get rejected immediately from a human, and they have the potential to form tumors or exacerbated cancer. Mesenchymal stem cells from the Wharton's jelly don't do that, and this study showed that, okay, nicely. And it's not just that study. There's plenty of others. Will stem cells be a cure for my condition? The answer is no. Rarely do we see a cure for the mesenchymal stem cells that we provide. We're talking about non-malignancy conditions, right? We're not talking about a bone marrow transplant for hematologic malignancy. We're talking about arthritis, stroke, diabetes. Stem cells are not a cure. People don't like to hear that. That's, the truth. Clinics around the world will sometimes tell you that they can cure whatever it is you're dealing with, and you would just need a treatment one time. And unfortunately, they're not being realistic. We like to be transparent. Once again, we like to provide accurate information. So I use the term mitigation. For instance, we wrote a paper on diabetes with stem cell therapy. It works fantastic for helping lower hemoglobin A1C, lowering the need for the medications for diabetes, sometimes getting you off insulin, maybe not after the first treatment, but it's not a cure. In addition, the stem cells can help prevent the secondary complications, such as neuropathy, ED, heart issues, stroke, kidney failure, but it's not a cure. Now, we developed the IntelliCell in Mexico. We do use it around the world now. These are cells that are specifically selected to produce the best result. What does that mean? So the mesenchymal stem cells we use are separated out from the bunch that we start with. We look for purity with the surface markers, potency with the colony forming units, viability to make sure they're alive, and less than the fourth passage of expansion. All right. Those are the ones that we take, that we put through the expansion. And like I said, we go to the fourth or less. Those are able to seek out inflammation and deposit themselves there and go to work, reducing that inflammation, helping with repair, regeneration. They are helping with differentiation of turning into many different types of cells. They are very persuasive in cell-to-cell signaling to turn on repair processes. They're very good promoters, and they promote the processes that we want and need for repair and regeneration. They are not promoting the bad processes. Like, they don't amp up an autoimmune disorder. It actually tamps down that part of the immune system. And they're able to promote repair processes. They don't form tumors. Some of the people actually call them anti-cancer forming. We don't promote it as that, but just to give you an idea. Do the numbers of stem cells matter for treatment? You're darn right they matter. The latest data on conditions show that to a point, higher numbers are better. And that's something you need to know, but also something that a lot of clinics don't want you to understand. They'll say, well, you only need 25 million stem cells for your, rheumatoid arthritis, and you weigh 100 kilograms. You're not going to get the result that you want you're going to be paying for a treatment. It's not going to work. Okay. We use calculations depending on what research shows works well and what our experience shows. It could be anywhere from 1 to 5 million stem cells per kilogram, depending on the condition that you're dealing with. So when you look at, for instance, ASD, autism, if a child weighs 20 kilograms and you give them 20 million stem cells, it's not enough. We'll typically do 80 to 100 million, multiply it by 4 or 5, right? And that may end up being, enough to get the improvements that we see. We don't give more than 100 million stem cells IV at any one procedure for safety reasons, and we don't know how many stem cells the body can use IV at any one point in time. Now, if it's being split up into intrathecal, IV, injection, then yeah, we'll make a judgment call on whether or not it needs to be split up into 2 treatments or not. What are the conditions that we treat? Well, you could see in the consumer guide that I wrote, there's over 30. There's really over like 50 to 70. Some of them are very, very rare, but it works well for a lot of rare conditions. But here you see autism, CP, neurodegenerative conditions, some movement disorders like Parkinson's, orthopedic, pulmonary like COPD, pulmonary fibrosis, autoimmune. There's a lengthy list of autoimmune conditions where it can help. Urologic, such as erectile dysfunction, diabetes, type 1 or type 2, ophthalmologic. We don't inject into the eye. We do indirect approaches, but it can work well for things like macular degeneration. We've had very good results with kidney failure. We published a paper a couple months ago of a case report of moving a patient from stage 5 to stage 4. He doesn't need dialysis now. We've had good results with heart disease and liver disease as well with cirrhosis. Reproductive, we're now doing stem cell therapy for premature ovarian failure. Me and my research team, we published a really good paper on this a few months ago. It works well, especially as a last resort. If patients have failed, they can't get a spontaneous pregnancy, IVF has failed. This procedure, there's a nice video, excuse me, on our YouTube channel showing how the procedure is done. We do transvaginal ultrasound, guided injections of what I call the trifecta: mesenchymal stem cells, exosomes, and PRP into each ovary. The PRP comes from your blood. We spin it to concentrate the growth factors and then add that to the stem cells and the exosomes. Here's a nice video of our Cancun office. A little bit of a drone there.
If you're wondering if it works, this is my 3rd time coming. I'm just throwing away every money and doing it because it feels good. It heals my joints.
All right, there was a quick snippet in there of a blood draw occurring. All patients who come to our Mexico clinics get free PRP, and that can be used as an injection with a joint or a soft tissue area, or we can apply it to your face with microneedling to help you look younger. All right, we don't charge for that. That's included. Everybody gets a multivitamin as well. So what kind of outcome can you expect, and for how long? Well, that's a loaded question, because when you talk about over 50 to 70 conditions, it's going to vary. Our overall patient satisfaction is 85%. year over year over year. We ask patients at a week, 3 months, 6 months, 12 months, would they do it again? And would they recommend it to friends and family? The answer 85% of the time is yes. It's much better than like a steroid injection, which actually makes you worse at the end of the day than you started with. Typically, patients get over a year for things like arthritis, often 2 to 5 years. But some conditions need a repeat procedure every 6 to 12 months, such as if you have liver failure so bad that your doctor has said there's nothing else we have to offer and your liver function tests are insane, we can help you, but you're going to need treatment every 4 to 6 months for a while to get things under control. In addition, with stage 5 kidney disease, yes, we can give high dosing and get you into stage 4, but you're going to need it for a while every 4 to 6 months. So it's not a one and done, but if traditional therapies aren't cutting it, it's a fantastic alternative. And I've spoken about that plenty when it comes to something like autism. We get parents coming to us very frustrated. ABA is not working, speech therapy, occupational therapy. Children are still not speaking or not speaking much. They no eye contact and very hyperactive, aggressive. This can work. Stem cell therapy works fantastic, 85% plus, but 2/3 of parents do bring their kids back to get additional improvements off of the initial. So what does that mean? That means that cost effectiveness is very important, right? And what happens is if you go to, say, Panama or one of our reputable competitors, their pricing tends to be 2.5 times what ours is. So a lot of patients call us and say, I went to Panama. The experience was good, but it was 25, 30,000. I can't spend that every year. So, we end up doing 100 million stem cells for like 9, 10. I mean, it's a big difference. What are the risks and side effects? Well, we talked about rejection. That doesn't happen. Tumor, there's no evidence that ever happens. Very low risk of infection. Have we seen it? Yes, we have seen some superficial cellulitis. And it's unbelievably rare, but we have seen it, and we've done 25,000 procedures. So, but we haven't seen a deep infection. We've seen low-grade fever, dizziness, lightheadedness, maybe some chills, maybe a little bit of nausea, maybe a headache. These things typically resolve within a day or two. Also, obviously, you might have some soreness if there was an injection done in the back of the knee or whatnot. Why consider R3 for your regenerative care? Well, there's a plethora of reasons. One is our outcomes. We have over 150 video testimonials on our YouTube channel and a lot more than that written. 35% of our procedures come from repeats and referrals. Our outcomes are second to none. The experience, we do include ground transportation with your procedure. We'll pick you up, for instance, from the San Diego airport. We have 3 vehicles, so it may be a smaller vehicle, it may be an SUV or a van sometimes if we have a lot of patients, but it's a great experience. The clinic is very contemporary, it's very modern. We are literally 3 minutes once you get to the San Diego Tijuana border. We're in Rio Zona, which is a very nice business district in a medical high rise. Our experience, we have over 25 customized options for procedures. Our providers are very experienced. In Mexico, they've been with us for 4, 5, 6 years, and we are the busiest in the world. And with that, we've brought our pricing, we've kept it as low as we can. The IntelliCell is prominent in why we have such great outcomes. Now, how do we come up with our pricing, and are there any extra fees? Let me see if there's any questions here that I can answer. Oh, geez, I missed a bunch of questions. Okay. Thank you, Rick, for your questions. Let me just bounce off a couple answers here. So no IntelliCell in Nashville. And the reason is because we're not allowed to expand stem cells in the United States. We do that internationally. Okay. Um, all right. So your question about um, nasal cavity versus IV. So I'm not going to type an answer. I'll just answer it. In the United States, we do intranasal, and we do that with often it's a combination of mesenchymal stem cells and exosomes. So intranasal, in the back of the middle turbinate, you have the cribriform plate, and that's what separates, the nasal cavity from the central nervous system, the brain. So can you get biologics through the cribriform plate? The answer is yes. Now, you don't do it with like a nasal spray, like an Afrin type of thing. That's not going to get back much at all. We use a special catheter. It's made of silicone. It's called the sphenocath, and that gets the catheter back to the middle turbinate area. The stem cells and exosomes are deposited there. They will migrate through the cribriform plate and the olfactory bulb into, and a decent percentage too, into the central nervous system. In the United States, that's the best way of doing it. It's very safe. It's very fast. Now, if you internationally, we'd like to do the intrathecal. And the reason is because you're getting right into the spinal cord. It's actually below the spinal cord. We're about L3, where the spinal tap entry is made. And it's very safe. I mean, we can get millions and millions of stem cells to the brain that way. Via blood. So here's the example. When Duke University did the autism study years and years ago, they did it all IV. Now, kids got better. Why? If the stem cells can't make it through the blood-brain barrier, how did that happen? Well, it's not a complete barrier. Some of the cells will get through, right? And some of the exosomes that come out of the stem cells will get through. We like to use them separately, stem cells and we like to use them together, separate biologics together, because the exosomes are so small, they don't care about a blood-brain barrier, right? They just get through. Let's see. Robert asked, how soon after a stroke do you recommend someone to come in? That's a great question. And the traditional thinking was that after a stroke, you get 1 to 2 years, maybe, of some natural recovery. And then neurologists say, well, I'm sorry, but either you have to live with it or figure out other ways to get things done. Maybe start becoming left-handed if the right's affected, things like that. Well, we know that that's not the case anymore. When they did a study at Stanford 10, 15 years ago, they did it a little bit in a ridiculous way. They actually used drill holes in the skull to put the stem cells in, but those patients got a lot better. And there's actually interviews of some of them online. We see the same thing. We don't give it through the skull. That's ridiculous. We do it intrathecal and then IV as well. And patients get a lot of improvements. There's probably 10 to 15 success stories on our YouTube channel. They get less brain fog, get better mental clarity, better motor function, better ability to speak and eat, better balance. It doesn't take you back to where you were before the stroke, but it's noticeable. And that's awesome. So we see that frequently, and it's been exciting to see that 5-7 years out from the stroke, as opposed to just within that initial time frame. Okay. Let me just. Oh, how long do exosomes work? That's a very good question, Rick. And the answer is we're not exactly sure. We've had some patients who get a few years of relief for things like neuropathy and whatnot. But others basically at 1 year they need to come back. So I don't like to answer questions that I don't have the answer to. I don't like to make it up, right? So I can't tell you exactly. So sorry about that. Let's see, nasal cavity. Soon after we talked about that. Yes. Okay. So here's one of the problems with a spinal fusion Or so, for instance, you go in for a laminectomy for spinal stenosis. It's a good procedure. It works well, but over half of patients end up with back tightness, stiffness, pain afterwards. Stem cell therapy is a great idea, so you can avoid a fusion. Now, for stenosis in general, a lot of people have spinal stenosis on an MRI, but they don't have any symptoms. So a lot of us just live with spinal stenosis that we don't even know we have. But if you do have symptomatic spinal stenosis, a lot of people are able to avoid the need for surgery with stem cell therapy. It doesn't take away the mechanical compression, right? Same way it's not going to take away a mechanical deformity of your knee or your spine, scoliosis. It doesn't do that. But what it does is it reduces inflammation. It helps promote repair, regeneration of your nerves, and it can help decrease the overgrowth of the tissue with stenosis. Now, when it comes to the spinal fusion, one of the problems with spinal fusion, here's an example, okay? Degenerative disc disease. I used to practice spine surgery. We would get a discogram, and the patient would say, yes, that reproduces my pain. And we would say, okay, we're going to do a fusion, and your pain's going to be gone. But studies show that's not the case. Most patients who had those spinal fusions were still on narcotics a year later. Their pain might be reduced 50%, but then they come back and they say, well, that wasn't good enough. Well, before the surgery, you said it was going to be great. And they're like, well, I changed my mind. I'm not happy. All right, well, rather than having another surgery, a stem cell procedure is going to be a better option. Our providers flood the low back with millions and millions of stem cells and exosomes and PRP. So it is the trifecta, okay? And flooding it plus the IV procedure has been a much better option than having another surgery with the risks and whatnot that come along with that. All right. Okay, Rick, you're asking about the nasal answer for dementia. Yes, it can help. And we've seen it help. I talked about using the silicone sphenocath to get back to the middle turbinate, and our provider does. And I've had it done to me. I get migraines, not really anymore after the procedure, but it's uncomfortable. It's weird sensation. It's not painful. And it's very fast. Okay. So the question is, how about for dementia? I prefer that our providers do it with intrathecal in Mexico because you can get a lot more stem cells for a patient with dementia, Parkinson's, ALS, MS, you name it. But if someone can't leave the States, intranasal is going to be the next best answer. It can help. Okay. All right, let me finish this slide. How did we come up with our pricing? I like to think of us as offering the Mercedes of stem cell therapy for the price of a Ford, or you get the analogy, right? I had a gentleman tell me last year, he said, man, you guys are the working man stem cell clinic. And I had another gentleman, I think he was a truck driver. He said, this is amazing. I want to thank you because I can afford this procedure. Whereas when he talked to CPI or BioAccelerator or whatnot, nothing against them, just they're very expensive. Okay. Our goal, yeah. So because of our economy of scale, because we do hundreds of procedures a month around the world, we've been able to keep our pricing down through, economies of scale. Our mission is to make effective stem cell therapy available to virtually everyone in need, not to cater to the 1% of the 1%, which is what most clinics are doing. And it's a huge disservice. This technology is awesome. Why would we want to just do it for the 1%, especially when, people come to us, they say, look, my kid's talking now. He looks me in the eye. It's changed his whole life. In fact, it's changed mine because we can now have so much more interaction and fun together. I want to do it again. Well, oftentimes they can't. If it's Panama or one of these other clinics, they're $25,000, $30,000. That's a lot to pay, every year. We do have some extra fees. And those don't go to us. They go to the anesthesiologist. For instance, for the sedation, we do use conscious sedation for a lot of procedures. patients, they're not out. It's like a child. You're for autism. They're not out. The parent can be in the room. They can see that their child is either sleeping or just very comfortable, and that's great, right? They don't feel it. They don't remember it. But there is a small extra, a few $100s for that. Intrathecal, a few $100. Extra days at the clinic. If you mention that you watch this, I will eat those extra days. I'll pay for them. Okay. Just let Marjorie or whoever your patient concierge. We have like 5 patient concierge representatives. Just tell them, and I'll take care of that. Okay. So here's our. Oh, wait a minute. There's our pricing. I'll get back to that. So we have 2 clinics, Tijuana and Cancun. Everything starts with a free phone consultation. There's no obligation. It's private, right? You and the doctor will be talking, and they'll listen to what your issues are. And then if you have imaging studies or labs, we would love to see those. Those can help a lot. Okay. We do use ultrasound for our injections at the clinic, so the doctors can not only be accurate, but they also can use it for diagnostic purposes. And they can see, how bad your arthritis, or do you have bursitis, and how much fluid is there and where. X-rays don't show that. Okay. We will help you with the travel logistics. If you need to stay overnight, depending on the level of the program, sometimes we'll pay for that. Okay. Beautiful hotel, 2 blocks from the Tijuana clinic is Hotel Lucerna. That's where I stay. It's a fantastic hotel, first-class service. For when it comes to the Cancun, you don't want to stay downtown. You want to stay in the hotel zone, right? That's where the beaches are, and we'll take you back and forth to your hotel. And a lot of times, depending on the level of cells that you're getting and paying for, there are some options for us to pay for your hotel too. As we talked about earlier, the advantages that we bring to the table are the outcomes that we provide, the incredible safety, quality control, the cell counts, because we are allowed to expand in Mexico. It is a fantastic option, and our pricing. So let me get to that. By the way, to learn more, stemcellmexico.com, fantastic website. A lot of my videos are on there. Okay, so Rick, you recommend stem cells for bad knees versus exosomes? Yes. So, for instance, we have multiple corporate locations in the United States. Stem cell therapy in the United States is legal. Okay, it's just not FDA approved, and you're also not allowed to, once again, expand the stem cells. So we don't. Okay, but we do offer it. New York City, Nashville, here in Scottsdale, Los Angeles. We have a clinic in Beverly Hills. All right, so let's go over, and then for knees or for joints, what we found works incredibly well over the years is 2 cc's of the Wharton's jelly biologic, and that has about 20 million stem cells in it. We include PRP at no additional cost. We don't include exosomes. We haven't found that to be necessary. We do more of the exosomes like IV or whatnot. And also the multivitamin is every patient gets that. All right. So let me run through the Mexico pricing. All right. So 25 million is our lowest amount at $37.50. You do get the multivitamin, but not the exosomes or hotel. 50 million is $49.50, and that includes 25 billion exosomes, 1 vial. 75 million is $72.50, and we do include 25 billion exosomes. If you mention that you watched the webinar, not for the 25 million, but for any of the other levels, I'll add in an extra 25 billion exosomes. Now, I don't want to combine that with the other videos where I've said that, right? But if you say that, we'll give you an extra 25 billion. So just mention that to Marjorie or Yolanda or Moses or Anna, you get it. 100 million stem cells. So, as an example, if you weigh 50 kilograms, and that's about 110 pounds, oftentimes women are in that range, and you need 2 million stem cells per kilogram, that's where you're going to be, right? If you're a gentleman who weighs, a couple 100 pounds, you're close to 100 kilograms, 220 or something. That's where you're going to be if it's 1 million stem cells per kilogram, like a diabetic or something. So if you look at that with Panama or CPI or whatnot, that'll be over 20,000 US dollars. And I'm not joking. Feel free, go get your consultation and quotation. That we see them all the time, right? And if you want us to price match that, we will. But at the end of the day, 8850 is a great value because we also give you 100 billion, 50 billion exosomes, 75 billion if you mention this, and then a couple free nights, in a hotel. Now the hotel is up to us, all right? Hotel Lucerna or maybe El Presidente in Cancun. That's where I stay. It's awesome on the beach. Now 150 million stem cells is 12,750, and you would end up getting 100 billion exosomes because you'll get 4 vials if you mention this. 175 million is 14,150. 200 million is 16,100. Now, if you are an individual who has, let's say, multiple sclerosis, and you weigh 75 to 100 kilograms, 200 million stem cells is what is going to be necessary. That is what all the studies have shown is going to be effective, and that's what our experience has shown too. And then you can see the rest of the pricing there. If you just want an exosome only therapy, that's 150 billion, actually, 6 vials. You know what? I'm not sure why I put 6 vials. But anyway, we'll do 100 billion exosomes because it's 25, but we've had this checked by a third party. It's 49.50. All right. Okay. So 200 million stem cells is over $30,000 with Panama or CPI. I've seen those quotes every week. Most clinics offer stem cells that have been overcultured, frozen, not nearly as effective. So I just had a question about COPD. There are quite a few video success stories on our YouTube channel. The process for COPD or fibrosis is a combo. I call it a hybrid procedure where patients will get a nebulizer from a compressive nebulizer with a combination of mesenchymal, it's the trifecta, mesenchymal stem cells, exosomes, and PRP goes into the cup, okay? And, that's a breathing procedure. It takes probably half an hour. And also an IV it's no sense in giving PRP IV. It just dilutes it back to blood. So we do mesenchymal stem cells and exosomes IV. Now, when you look at the success stories, it's very common. Most patients within about 3 weeks or so, they're talking about how much easier it is to breathe. They can walk farther. The last success story was here in this office. He didn't need his assistants anymore to walk. Dr. Solt was astonished. He walked in by himself. He had a conversation with her on the way back to the treatment room. And he came back after 3 months, not because it wasn't working anymore, because he went from here to here. He wanted to go to here. Okay. And that's totally possible. But as far as how long does it work, I talked about that before. It's a tough question to answer. It depends. If someone's on 10 liters of oxygen, maybe you have to get another treatment after 6 months. Might be a year. Now, for something like neuropathy, we've had patients come back in 3 years. There was a nice study on rheumatoid arthritis of patients who got high levels of stem cells, and their average remission lasted 3 years. So it can last, for a decently long period of time. Okay, so all right, so I got a question about inflammation in the neck from New Hardware, and After 3 months of a surgical procedure, most of the time the wound is healed, the hardware has promoted the fusion, and then you can start thinking about a stem cell therapy to help. If the surgeon is okay with it, we could do it before then, but we don't want to interfere, with their desires. All right, that's a bad idea. So a lot of times, as I mentioned, a neck fusion or a low lumbar fusion helps a lot, but it doesn't get rid of all the pain. Oh, look, I spelled stem cell wrong. So on this page, it's actually stem cell with two L's, Mexico.com. Huh. Surprised I didn't catch that. But anyway, that's our website for Mexico. The phone number is right there. It's the USA prefix. We'll get you set up with free consultation. And yeah, tell the patient concierge representative you watched the webinar, and the following is what you'll get. I will allow you to get $250 off and an extra 25 billion exosomes for Mexico. Okay. It's a fantastic opportunity. We have so many success stories from Mexico. Like I said, it's 150. Who else do you know who has 150 video success stories? We had a patient, Nigel Taylor. If you go on our website, r3stemcell.com, and you scroll down, you can download Nigel's book. I didn't ask Nigel to write a book about his experience, but it's amazing. It's called Our Stem Cell Journey. He actually wrote a second book. It's out. I need to read it. It came out last week. But I was shocked. Him and his wife got treatment. He was on disability. He is back at work. He had bad thumbs. He had bad lung disease, and he's doing 100% better. So things like that are really are humbling to me, and it's amazing to be able to see how many people get helped with these therapies day in and day out. I think I answered most of the questions. I apologize if I missed one. If you want, feel free to email me. You can email info@r3stemcell.com. I get copied on those. Or just email me directly. I don't mind. Greene with an E on the end at r3stemcell.com. Let's see. Robert is asking about the replay. Yes. So the software is set up to send you. Yes, Rick. We'll mention to Dr. Worthington or Samantha in Nashville. We'll get you some free exosomes. Absolutely. We'll get you a vial that has 25 billion in it. No worries. So yeah, if you email me with your questions, I'll hopefully get you an answer. Or, I look it up a lot of times. I have a full research team. We published 10 papers in the last 2 years. We're very active in that regard. Okay. So thank you so much for participating today. Look forward to hearing from you. If it's after the therapy, please hit us up. We're not one of those clinics that, does the treatment and then doesn't want to hear from you again. Good, bad, indifferent. I'd love to hear from you. Okay. Thanks again. And thanks for attending. Hope to hear from you. All right. I'm going to put a stop on this. Oh, you will get the replay tomorrow.